161. A nurse is preparing to administer a blood transfusion. Which action should the nurse take first? A. Verify the patient's identity using 2 identifiers. B. Start the transfusion at a slow rate. C. Check the patient's vital signs before transfusion. D. Prime the blood tubing with normal saline. Answer. A. Verify the patient's identity using 2 identifiers. Rationale. Ensuring the correct patient is identified before the transfusion reduces the risk of errors. 162. A nurse is caring for a patient who is at risk for deep vein thrombosis, DVT. Which intervention is most effective in preventing DVT? A. Encouraging the patient to perform leg exercises every 2 hours. B. Administering prophylactic antibiotics as prescribed. C. Applying warm compresses to the legs. D. Restricting fluid intake. Answer. A. Encouraging the patient to perform leg exercises every 2 hours. Rationale. Leg exercises improve circulation and reduce the risk of DVT formation. 163. A nurse is caring for a patient who is receiving anticoagulant therapy. The patient's international normalized ratio, INR, is 6. What is the nurse's priority action? A. Administer a dose of vitamin K. B. Notify the healthcare provider immediately. C. Increase the dose of anticoagulant. D. Encourage the patient to drink more fluids. Answer. B. Notify the healthcare provider immediately. Rationale. An INR of 6 indicates an increased risk of bleeding, and the healthcare provider should be notified for further management. 164. A nurse is caring for a patient who is at risk for falls. Which intervention is most important to reduce the patient's risk? A. Encourage the patient to use a walker. B. Keep the patient's call light within reach. C. Place the patient in a side-lying position. D. Provide the patient with a soft pillow for comfort. Answer. B. Keep the patient's call light within reach. Rationale. Ensuring the call light is within reach helps the patient request assistance, reducing the risk of falls. 165. A nurse is assessing a patient's vital signs. The nurse notes that the patient's blood pressure is 160/90 mmHg. Which action should the nurse take first? A. Document the blood pressure reading. B. Take the blood pressure again after 5 minutes. C. Notify the healthcare provider immediately. D. Administer an antihypertensive medication. Answer. B. Take the blood pressure again after 5 minutes. Rationale. Reassessing the blood pressure is important to confirm the initial reading before taking further action. 166. A nurse is caring for a patient who has just undergone a laryngectomy. The patient is at risk for aspiration. Which of the following actions should the nurse take to minimize this risk? A. Encourage the patient to drink fluids through a straw. B. Teach the patient to cough forcefully. C. Place the patient in a semi-Fowler's position during meals. D. Offer solid foods first to promote swallowing. Answer. C. Place the patient in a semi-Fowler's position during meals. Rationale. A semi-Fowler's position helps prevent aspiration by improving swallowing and reducing the risk of food or liquids entering the airway. 167. A nurse is caring for a patient who is receiving a high dose of corticosteroids. The nurse should monitor for which potential side effect? A. Hypokalemia. B. Hyperglycemia. C. Hypotension. D. Weight loss. Answer. B. Hyperglycemia. Rationale. Corticosteroids can increase blood glucose levels, leading to hyperglycemia. 168. A nurse is preparing to discharge a patient who has just undergone a cholecystectomy. Which statement by the patient indicates a need for further teaching? A. I should avoid heavy lifting for 4 to 6 weeks. B. I can resume my regular diet immediately. C. I should report any unusual pain or jaundice to my doctor. D. I will need to take prescribed pain medication for a few days. Answer. B. I can resume my regular diet immediately. Rationale. After a cholecystectomy, the patient may need to avoid fatty foods for a while and gradually reintroduce foods to their diet. 169. A nurse is teaching a patient with asthma how to use a metered dose inhaler, MDI. Which statement by the patient indicates that teaching has been effective? A. I will hold my breath for 5 seconds after inhaling the medication. B. I should exhale fully before using the inhaler. C. I will shake the inhaler only once before use. D. I will use the inhaler immediately after eating. Answer. B. I should exhale fully before using the inhaler. Rationale. The patient should exhale fully before using the MDI to ensure the inhaler is used effectively. 170. A nurse is caring for a patient with a chest tube. Which of the following interventions should the nurse implement? A. Ensure that the chest tube is clamped during transport. B. Keep the drainage system below the level of the chest. C. Change the chest tube dressing every 12 hours. D. Encourage the patient to cough and deep breathe frequently. Answer. B. Keep the drainage system below the level of the chest. Rationale. Keeping the chest tube drainage system below the level of the chest prevents backflow and promotes drainage. 171. A nurse is caring for a patient who has been prescribed an angiotensin-converting enzyme, ACE, inhibitor. Which side effect should the nurse inform the patient about? A. Dry cough. B. Increased appetite. C. Hair loss. D. Joint pain. Answer. A. Dry cough. Rationale. A dry cough is a common side effect of ACE inhibitors, and the nurse should inform the patient about it. 172. A nurse is caring for a patient who is receiving morphine for pain management. The nurse should monitor the patient for which common side effect? A. Tachycardia. B. Hypertension. C. Constipation. D. Hyperactivity. Answer. C. Constipation. Rationale. Morphine and other opioids commonly cause constipation due to their effect on the gastrointestinal system. 173. A nurse is caring for a patient with a history of substance abuse who is recovering from surgery. Which intervention should the nurse prioritize? A. Administer pain medication as prescribed, but avoid opioid use. B. Avoid discussing pain with the patient. C. Administer large doses of narcotics to prevent withdrawal symptoms. D. Encourage the patient to stop taking any prescribed pain medication. Answer. A. Administer pain medication as prescribed, but avoid opioid use. Rationale. The nurse should manage the patient's pain appropriately while avoiding the use of opioids, which could trigger substance abuse. 174. A nurse is caring for a patient who has been diagnosed with an upper respiratory infection. The patient asks whether antibiotics are necessary. What is the nurse's best response? A. Antibiotics are necessary to prevent a secondary infection. B. Antibiotics will cure the infection quickly. C. Most upper respiratory infections are viral and do not require antibiotics. D. Antibiotics will help reduce symptoms, but will not cure the infection. Answer. C. Most upper respiratory infections are viral and do not require antibiotics. Rationale. Most upper respiratory infections are caused by viruses, and antibiotics are not effective against viral infections. 175. A nurse is caring for a patient with an indwelling urinary catheter. Which of the following actions should the nurse take to prevent a urinary tract infection, UTI? A. Cleanse the perineal area from back to front. B. Use a sterile technique when inserting the catheter. C. Leave the catheter in place for as long as possible. D. Clamp the catheter every 2 hours to allow urine to accumulate. Answer. B. Use a sterile technique when inserting the catheter. Rationale. Using a sterile technique during catheter insertion is essential in preventing UTIs. 176. A nurse is caring for a patient with a history of stroke. The nurse notes that the patient is unable to move their left arm. Which action should the nurse take first? A. Document the finding in the medical record. B. Reassess the patient's neurological status. C. Notify the healthcare provider. D. Administer pain medication. Answer. B. Reassess the patient's neurological status. Rationale. A change in the patient's ability to move an arm could indicate a neurological emergency, and further assessment is necessary. 177. A nurse is caring for a patient who is post-operative following a hip replacement surgery. Which of the following is most important to assess in the immediate post-operative period? A. The presence of bowel sounds. B. The patient's ability to void. C. The color of the surgical dressing. D. The patient's pain level. Answer: C. The color of the surgical dressing. Rationale: monitoring the surgical dressing for signs of infection or bleeding is a priority in the post-operative period. 178. A nurse is preparing to administer an intravenous medication to a patient. Which action should the nurse take to ensure the medication is given safely? A. Verify the medication order with a healthcare provider. B. Ensure the intravenous site is patent and free from complications. C. Ask the patient to confirm their medication allergies. D. Administer the medication as quickly as possible to avoid side effects. Answer: B. Ensure the intravenous site is patent and free from complications. Rationale: ensuring the foresight is patent and free from complications is essential for the safe administration of intravenous medications. 179. A nurse is caring for a patient who is prescribed warfarin. The nurse should monitor for which laboratory value to assess the effectiveness of the medication? A. Hemoglobin level. B. International Normalized Ratio, INR. C. Platelet count. D. Activated partial thromboplastin time, APTT. Answer: B. International Normalized Ratio, INR. Rationale: the INR is used to monitor the effectiveness of warfarin therapy and ensure the patient is within the therapeutic range. 180. A nurse is caring for a patient with a history of heart failure. The nurse should monitor the patient for which sign of fluid overload? A. Decreased blood pressure. B. Increased respiratory rate. C. Increased urine output. D. Weight loss. Answer: B. Increased respiratory rate. Rationale: fluid overload can lead to pulmonary congestion and an increased respiratory rate. 181. A nurse is assessing a patient who is post-operative following abdominal surgery. The patient reports sudden severe abdominal pain and a feeling of pressure. Which action should the nurse take first? A. Check the surgical dressing for signs of infection. B. Assess the patient's vital signs. C. Notify the healthcare provider immediately. D. Administer pain medication as prescribed. Answer: B. Assess the patient's vital signs. Rationale: assessing vital signs helps determine if the patient is experiencing shock or complications like hemorrhage, which requires immediate intervention. 182. A nurse is preparing to administer an 4-push medication to a patient. Which action should the nurse take first? A. Verify the medication order. B. Check the patient's allergies. C. Ensure the 4-line is patent. D. Administer the medication slowly. Answer: C. Ensure the 4-line is patent. Rationale: it's essential to confirm that the 4-line is patent before administering any medication to avoid complications. 183. A nurse is caring for a patient who has a prescription for a saline lock. What is the primary purpose of a saline lock? A. To maintain access for emergency medication. B. To provide continuous fluid hydration. C. To administer blood products. D. To keep the 4-line in place for future use. Answer: D. To keep the 4-line in place for future use. Rationale: a saline lock is used to maintain access for future medication or fluid administration without continuous infusion. 184. A nurse is caring for a patient who is at risk for developing pressure ulcers. Which action should the nurse take to reduce the risk of pressure ulcers? A. Reposition the patient every 2 hours. B. Keep the head of the bed elevated to 45 degrees. C. Massage bony prominences to improve circulation. D. Use a low air loss mattress. Answer: A. Reposition the patient every 2 hours. Rationale: regular repositioning helps reduce pressure on bony prominences and decreases the risk of pressure ulcers. 185. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD. The nurse should be especially cautious about administering which of the following medications? A. Anticholinergics. B. Inhaled corticosteroids. C. Oxygen therapy. D. Sedatives. Answer: D. Sedatives. Rationale. Sedatives can depress respiratory function, which is particularly dangerous in patients with COPD who already have compromised respiratory status. 186. A nurse is preparing to administer a medication through a nasogastric NG tube. Which of the following actions should the nurse take first? A. Check the patient's medication list for contraindications. B. Verify the placement of the NG tube. C. Crush the medication and mix it with water. D. Aspirate for stomach contents. Answer. B. Verify the placement of the NG tube. Rationale. Verifying the placement of the NG tube ensures the medication is delivered to the correct location. 187. A nurse is caring for a patient who has been prescribed warfarin. The nurse should monitor which laboratory value to assess the effectiveness of the medication? A. Hemoglobin level. B. International Normalized Ratio, INR. C. Platelet count. D. Activated Partial Thromboplastin Time, APTT. Answer. B. International Normalized Ratio, INR. Rationale. The INR is the primary lab value used to monitor the therapeutic effect of warfarin therapy. 188. A nurse is caring for a patient with a history of hypertension. The nurse should prioritize which of the following interventions? A. Administer antihypertensive medications as prescribed. B. Encourage the patient to increase fluid intake. C. Monitor for signs of hypoglycemia. D. Promote regular exercise and a low-sodium diet. Answer. D. Promote regular exercise and a low-sodium diet. Rationale. Lifestyle modifications such as exercise and a low-sodium diet play a crucial role in managing hypertension. 189. A nurse is caring for a patient who has undergone a thyroidectomy. Which of the following complications is the nurse most concerned about? A. Hypocalcemia. B. Hypertension. C. Hypoglycemia. D. Hyperthermia. Answer. A. Hypocalcemia. Rationale. Damage to the parathyroid glands during thyroidectomy can lead to decreased calcium levels, resulting in hypocalcemia. 190. A nurse is caring for a patient who has undergone a stroke. The patient is unable to swallow. Which of the following interventions should the nurse implement to prevent aspiration? A. Provide liquids with meals. B. Encourage the patient to chew gum. C. Place the patient in a high Fowler's position. D. Give the patient soft foods. Answer. C. Place the patient in a high Fowler's position. Rationale. A high Fowler's position helps prevent aspiration by improving swallowing and decreasing the risk of food or liquid entering the airway. 191. A nurse is teaching a patient who has recently been prescribed insulin. Which statement by the patient indicates that further teaching is necessary? A. I will check my blood glucose levels before meals. B. I should rotate injection sites to avoid tissue damage. C. I will increase my insulin dose if I feel sick. D. I will store my insulin in the refrigerator. Answer. C. I will increase my insulin dose if I feel sick. Rationale. Illness can increase blood glucose levels, but the patient should consult with their healthcare provider before adjusting insulin doses. 192. A nurse is caring for a patient who has recently been diagnosed with type 1 diabetes. The nurse should provide which of the following information? A. You will need to monitor your blood glucose levels at least once a week. B. Type 1 diabetes can be controlled with oral medications only. C. Insulin is required for lifelong management of type 1 diabetes. D. You can avoid insulin by following a strict diet and exercise plan. Answer. C. Insulin is required for lifelong management of type 1 diabetes. Rationale. Type 1 diabetes requires lifelong insulin therapy due to the inability of the pancreas to produce insulin. 193. A nurse is caring for a patient with a wound infection. The nurse should use which of the following techniques to ensure proper hand hygiene? A. Wash hands for at least 5 seconds. B. Use alcohol-based hand sanitizer if hands are visibly dirty. C. Rub hands together for at least 20 seconds with soap and water. D. Use soap and water only when caring for infected patients. Answer: C. Rub hands together for at least 20 seconds with soap and water. Rationale: proper hand hygiene involves washing hands for at least 20 seconds with soap and water, especially when caring for patients with infections. 194. A nurse is caring for a patient who is experiencing acute pain following a fracture. Which of the following interventions should the nurse prioritize? A. Encourage the patient to use relaxation techniques. B. Administer pain medication as prescribed. C. Apply a warm compress to the affected area. D. Help the patient change positions frequently. Answer: B. Administer pain medication as prescribed. Rationale: administering pain medication is the first priority to address acute pain and promote comfort for the patient. 195. A nurse is caring for a patient with diabetes mellitus who has a blood glucose level of 50 milligrams per deciliter. What is the nurse's priority action? A. Administer insulin as prescribed. B. Give the patient a snack with 15 grams of carbohydrates. C. Assess the patient's urine output. D. Prepare to administer a glucagon injection. Answer: B. Give the patient a snack with 15 grams of carbohydrates. Rationale: a blood glucose level of 50 milligrams per deciliter is hypoglycemia, and the priority action is to treat with carbohydrates to raise the blood glucose level. 196. A nurse is caring for a patient with a history of seizure disorder. Which of the following interventions should the nurse implement to prevent injury during a seizure? A. Place the patient in a high Fowler's position. B. Restrain the patient's arms and legs during the seizure. C. Place a padded tongue blade in the patient's mouth. D. Clear the area of sharp objects. Answer: D. Clear the area of sharp objects. Rationale: clearing the area of sharp objects helps prevent injury during a seizure, as the patient may thrash or fall. 197. A nurse is assessing a patient for signs of dehydration. Which of the following findings is most indicative of dehydration? A. Increased urine output. B. Moist mucous membranes. C. Dry skin and decreased skin turgor. D. Normal blood pressure. Answer: C. Dry skin and decreased skin turgor. Rationale: dry skin and decreased skin turgor are key signs of dehydration. 198. A nurse is caring for a patient who is receiving a blood transfusion. The nurse notices that the patient is developing a fever and chills. Which action should the nurse take first? A. Stop the transfusion immediately. B. Notify the healthcare provider. C. Administer antipyretics as prescribed. D. Take a blood culture from the patient. Answer: A. Stop the transfusion immediately. Rationale: a fever and chills may indicate a transfusion reaction, so the first priority is to stop the transfusion. 199. A nurse is caring for a patient with a chest tube. The nurse should notify the healthcare provider if which of the following occurs? A. The drainage system is below the level of the chest. B. There is bright red blood in the drainage tube. C. The patient is coughing occasionally. D. The chest tube is connected to suction. Answer: B. There is bright red blood in the drainage tube. Rationale: bright red blood in the chest tube may indicate active bleeding, which requires immediate evaluation by the healthcare provider. 200. A nurse is caring for a patient who is receiving a blood transfusion. Which action should the nurse take if the patient develops shortness of breath during the transfusion? A. Continue the transfusion at a slower rate. B. Stop the transfusion immediately and notify the healthcare provider. C. Administer oxygen and continue monitoring the patient. D. Increase the rate of the transfusion to relieve symptoms. Answer: B. Stop the transfusion immediately and notify the healthcare provider. Rationale: shortness of breath during a transfusion may indicate a transfusion reaction, and the nurse should stop the transfusion and notify the healthcare provider immediately.